So let's start by bringing our feet directly underneath our hip joints. So a little bit of turn out of the feet is fine, as long as it's small, but then we want our ankle, knee and hip joints sitting inside here, all in a straight line, and just encouraging them knees to be turning out in line with the front of the hips and the toes as well. And then we're going to just make sure our knees are unlocked, but without moving our knees in that unlocked position, we're going to isolate some pelvic tilts. So tighten through your tummy. Start to tuck the tailbone, but try not to push the knees forward when you do it. Keep the legs where they are to encourage good extension of the hips and good activation of the glutes here. So squeeze your bottom. And then we're going to go the other way and just soften that. Encourage just a little bit of extension in the lower back, but not to the point where it's painful. And then back into that tuck, tummy tightening, squeezing the bottom, and then taking it the other way. So just doing our best to really isolate this movement at the pelvis. And we can be doing this every day when we're standing, just to get these muscles working for us, supporting that lower spine, and to bring a bit of stretch into our hips. So really try and isolate, tuck and squeeze with good intention into the bottom. And now we want to find as close as we can and just get the feel of it, that neutral position of the pelvis where we're not tucking or leaning back, we're just level front and back with just a small natural lumbar spine curve if we can find that point. And then the rib cage, important part, that we're not leaning back with the rib cage. So ribs tucking into and down slightly to get them ribs level, and it might even feel like you're actually leaning forward a little bit. So maybe just think about pushing into the balls of the feet a little tiny bit more than the heels, if that helps. You stop that sort of leaning back feeling. And then shoulders down, arms relaxed, chin drawing in, head and neck balance on shoulders. And then just a couple of times here, we're going to activate the core muscles, including the pelvic floor. So just take a natural breath in. As you breathe out, tighten around the tummy, pull up through your pelvic floor muscles, get them as strong as you can, maximum engagement. Hold it for a few breaths here, just for a few moments. Be aware of the rest of the body, that you've not brought any extra tension in anywhere else. And then just gently relax all that tension. So you can feel the difference in them two extremes. Then again, just take a breath in. As you breathe out, tighten the muscles around the middle, pull up through the pelvic floor as we just practice holding and getting used to this neutral position as close as we can, and then waking up that center. And then slowly relax it completely. But now just tighten it to about 30% of your maximum. So gentle engagement around the center and through the pelvic floor that we can sustain. Practice a couple of breaths here, in through the nose, encouraging your rib cage to expand. And out through the mouth. We inhale, ribs expand. Without our shoulders lifting, holding onto the tension of our core. And then breathe in, bring your arms up to your shoulders. Without leaning back, reach up to the ceiling. Really think about them ribs staying tucked in and down through the front of the body. Breathe in and breathe out, arms back by the sides. And again, breath in, breath out. Try not to lean back. Think more about just leaning forward a little bit through the balls of the feet and pushing the ribs in and down. Doing our best to keep that strong posture. Just one more, breath in. Just to bring that little bit of challenge in, just with a little bit of warm up of our lats and mobilization of the shoulders in that standing neutral. Okay, and now take a breath in. Breathe out, tuck your chin and roll your spine. As we tuck our chin and drop our ribs into us and down to our hips, we keep our hips in neutral for as long as possible. Maybe we're going to bend the knees more once the hips start to come forward to protect the lower back. And then letting go of the upper body as much as we can, keeping the abdominals activated, the pelvic floor, and then breath in at the bottom, breath out. Pull yourself up through your tummy, through your pelvic floor muscles, making sure we've got that extra support with the legs if we need it. And you could do your roll down and up against a wall if you prefer to help you get a little bit more range of movement and a bit more focus. And then breathe in. Breathe out, tuck the chin, draw the ribs in and down, get that movement of your rib cage without moving the hips to start with, and see how far you can go with that. Still just pushing the weight a little bit more into the balls of the feet so we're not dropping backwards. And then still feeling as we relax the upper body that we're really drawing up through the tummy and the pelvic floor, and then breathing in and using our breath out to start to bring our way back up to our standing position, working to get and find it, that neutral that we set up. And then we're coming down onto the mats. Breathe in, breathe out, tuck your chin, start to roll. And again, just working that segmental movement, relaxing tension out of the arms, the neck, the shoulders, but still feeling the tension in the center. And then when we get to the bottom, bend the knees, get your hands flat, walk your knees down onto your mat, and then we want to place our wrists underneath our shoulders, our knees directly underneath our hips. And we're just going to bring a bit more mobility into the spine here. So pull up through your tummy muscles, tuck your tailbone down towards the back of the knees and around your spine. And then we're going the other way, which we can encourage a little bit more lumbar extension comfortably without overloading the spine. So drop your tummy, drop your ribs, and draw the shoulders down the back gently, and then draw back up through your belly button first, tucking the tailbone, activating low in the abdominals, gradually rounding your spine and tucking your chin under. We're going back through the other way, just staying as balanced as we can on these 4 points with our arms straight. Shoulders pull down the back, little opening of the chest and lifting the tailbone. Let's do that one more time. Really concentrating on getting, again, as much segmental movement as we can through the spine in our flexion, but also in that extension as well. Dropping through the ribs, dropping through the tummy, shoulders down the back. And then we're just going to find a neutral position here for a moment. So shoulders down, ribs level, pelvis level, and then engage your core muscles. Just to do a little plank here, a 4-point kneeling plank. So tuck the toes under, take a breath in, breathe out and lift your knees off the mat for a tiny amount and hold. Now if you can't hold it for a few breaths, then just start by practicing releasing it on your inhale, exhale to lift. And this is just a great way of starting to bring some tension, some core work in through the whole of the core, including the scapular area, the arms. And it's something you can build on with how long you hold for, but do it in a good, strong, neutral position. And then bring them knees down, drop the toes behind you, sit back on the legs, take a stretch and reach through them arms down to your fingertips, and maybe lift your fingertips and gently stretch your wrists. And breathe into the back. Release your hands, curl up out of the position, around into seated position where we're going to roll down and lie down on the mat. See if we can do that with a good bend of the knees and the feet on the floor. Lift your spine up as tall as you can. Take a breath in, breathe out, tuck your tailbone underneath you. Start to activate low down in your abdominals, pushing your ribs in and down. Chest open, shoulders down as we work to roll our spines down onto the mat. And then as we get down, sliding our feet so our legs are in a right angle position. Shoulders as we lie down, tuck down the back, arms by the sides, relax with the palms down. And then make sure your neck is comfortable, making sure we use neck support to lift our heads a little bit where we need to help us work to keep our ribs flatter in the mat where we need to. So then we're going to rock our pelvis here. Great mobility for the lower back, just gently imprint your spine, isolating through your abdominals, but then taking it the other way again so we can get a bit more movement around the lower back as we gently arch the back. Roll back through, segment by segment to imprint your spine. Naturally, you might get some tilting of your tailbone, and then take it the other way, gentle arch of the back. And we do that again. Just doing our best to isolate the muscles in the center when we imprint the spine, so we can practice not bringing tension anywhere else into the body right now. Then we're going to try and get our spine in neutral here, lying down. So take the time to get the pelvis level from belly button down to pelvic bone. So try not to be tilting up initially at all if you can avoid it. And feel your level across your hips from one side to the other. Now the goal is to keep the pelvis there and work to press our rib cage flat into the mat as much as we can. That's where the lifting of the head may help, to help the ribs sit a bit flatter so we're not straining into the necks to try and get our ribs down. So as close as we can, flat ribs on the mat, something you can keep working on with daily practice, with a level pelvis. If we have to tilt the pelvis just a little bit to stop us having a gap underneath our back, then we will have to do that and build on it. But try and get as close to that as you can, just working with a tiny 2-finger gap for the natural curve of the lower spine. Now we want to keep it there, and we do it using the core. So scapular stability is part of that, so shoulders down, conscious pressing into the ribs, tightening around the middle with them corset muscles activated, so we're bracing and drawing up through the pelvic floor, and you'll challenge that tension as much as you need to. And then breathe in. As you breathe out, lift the right foot off the floor and float your knee up in line with your hip, shin in line with the ceiling. Breathe in, float it back down onto the floor, doing our best not to let our spine move at all. Breathe out, left leg floats up, knee in line with hip, no further, shin in line with the ceiling. And then we just repeat it with our strong focus being on our setup, making sure we're keeping it in place. Let that be the most important thing for you right now, is keeping the ribs as flat as you can and working with that level pelvis. Isolation of the core, so try not to be pushing your other foot into the floor when you're lifting the opposite foot. So single tabletops lifts of the legs can become pretty challenging, and we can do them daily without, overloading and overworking the lower back or the hip flexors by like we do when we do toe dips. So these can be done daily to help you really get good balanced core work, because you're focusing on keeping the posture correct and not compensating the posture by trying to work the higher levels. Let's do one more on the left. Floating the leg up, and then breathe in to bring it down. And then we'll take a breath in. We'll breathe out, stabilizing the pelvis. Just take your right leg out to the side. Try not to let your spine or hips move at all. Breathe in to come back. Focus on using the core, stabilizing in neutral. Breathing out, left leg floats out to the side. Breathe in to come back. Focus on your fundamentals, positioning, stability in that position, core muscles being isolated, and then breath, not forgetting pelvic floor, staying as light as we can on the legs. Okay, breathe in to come back. With the left leg, you'll breathe out, bring your right leg to tabletop and hold it. Take another breath in, breathe out, and we'll bring the left leg up as well. So we can work the higher level now, and if we need to, we'll flatten the back a bit more and maybe have to tilt the pelvis a little, but do your best to work with that level pelvis and flat ribs. Definitely don't work with any gap down your back with the legs in tabletop. And breathe into that for a few moments. And if you want to add in toe dips, you can. So you'll breathe in, lower your right foot, tap the floor, breathe out, bring it back to tabletop. Breathe in, lower left foot, holding strong in our neutral spine, breathing out to come up, and doing your best to keep the tension out of your neck and shoulders, and having that support underneath the head can help that and will help you keep them ribs down. Breath into lower, without bending the knee if we can avoid it, without letting the weight of our foot hit the floor. Doesn't matter which part of the foot touches the floor, but try not to let the weight drop. Finish on the left side. If you're doing toe dips, remember you can practice holding. Breathe in, lower your right foot back down, and then breathe out and lower your left foot back down. Link your fingers together, hook your hands to the back of the head. This is where we're going to practice again, keeping our pelvis stabilized, but actually curling just our head and shoulders off the mat. So we breathe in, we breathe out, push our ribs towards the hips, curling from the top of the shoulders to the bottom. Without really curling through the neck, we're lengthening the neck. Pelvis stays level at the bottom. We breathe in to come back down. Breathe out, supporting the weight of the head just as much as we need to get out of the neck as we curl up, and we practice this rounding, this flexion from the top of our shoulders to the bottom of our shoulders. At the same time, just for now, try and keep your legs really relaxed so you're not pushing your feet in, you're not creating any tilt here of the pelvis. We're working to keep level, so we're using the bracing around the middle, the drawing up of our pelvic floor for our stability of the pelvis and then space between the chin and chest. So we've got a nice bit of length in them vertebrae in the neck. We're not compressing anywhere. And then if we want to just challenge it a bit more into that rib cage area, we can hold for some little pulses. Just make sure when we do our pulses that we're not pulling on the neck. We're pushing ribs to hips. We're still keeping the pelvis really still. And we're just feeling that work a bit more in our rib cage area across here. Okay, and then bring it down. Release your head. Bring your arms by your sides. Allow your neck, arms and shoulders to relax. And then maybe stepping the feet a little bit closer to the bottom. You can start to work with them ankles underneath knees. You can start to work with them a little bit further away at any point if you want to. But start here, and we're going to bridge, and we're going to really get our glutes working now. So take a breath in, breathe out. We go from neutral into our flat back, so we feel the difference as we imprint. We're going to push through our feet and activate through the back of the legs, but then we want to be getting into our glutes as soon as possible, peeling our spine off the mat. Now it might be that we keep our ribs much lower. We might have to work to keep them down. See how you feel, but aim to stretch your hips and feel tension at the top of the legs coming into the glute maximus. Take a breath in there at the top, and then breathe out and slowly roll your spine back down. So we're bringing mobility back into the spine, along with strength work of quads, hamstrings, glutes, the core. Once you get to neutral, take a breath in, breathe out, neutral to flat back. Imprint the spine first as you push the feet in. Try and work balance on the inside outside ball and the heel of your foot. Let your first goal be to get the pull up the thighs into hip extension and the tuck in of the tailbone up into the back of the knees. So good glute activation, and we're not going to extend and put any unnecessary tension in the lower back if we can avoid it there. Breath in, and then breath out, rolling down. So that might mean just working the rib cage much lower down for some. And see how you get on. So breath in, let's do that again. Breath out, core muscles are engaged, including pelvic floor. Keep an eye on your knee, hip joint alignment, feet grounded, and looking to lengthen up the legs till we can get good extension of our hips. Tuck in the tailbone, squeeze in the bum, and if you're finding it hard to get the stretch in the hips, try ribs lower rather than ribs higher. Breathe in, breathe out, roll back through, vertebrae by vertebrae, imprinting the spine, coming to neutral. We'll hold it on the next one so we can get deeper work into the glutes. Breath in, breath out, imprint, peel off the mat just to where you think you can get the maximum bit of tension into the bottom. So I'm sitting my ribs quite low, getting a good stretch of the hips. You might be a little bit higher, but just remember it's top of the legs coming into the bottom that we want to feel it. And we can place the hands there for awareness. Then breathe in, breathe out, tuck your tailbone a little bit more up into the back of the knees, squeeze your bottom. Breathe in, release a tiny bit, just here, feel that release at the back, top of the back of the leg. Breathe out, squeeze into the bottom. Breathe in, release a small amount. Breathe out, squeeze your bum. So a slow controlled movement as we release, and then we're coming back into that hip extension as we tuck, and just that intentional working into the glutes. So if it's not natural that the glutes are just working, good intention with our movements, good intention to try and stretch up the thighs and extend into the hips that bit more. Couple more here. Core muscles working for our stability. Squeeze the bum and then breathe in, breathe out, roll your spine back down onto your mat, vertebrae by vertebrae, imprint your spine, find neutral, so try to get this level pelvis again, flat ribs, no more than tiny 2-finger gap for natural curve of spine. Take a breath in, breathe out, right leg back to tabletop, left leg back to tabletop. Option to lift your head and shoulders if you want to, so you can breathe in, breathe out, curl the head and shoulders off the mat, but not straining our necks and reaching our arms up to do the 100. So pump the arms, breathing in, 2, 3, 4, 5, and out, 2, 3, 4, 5. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. So just pumping the arms without jolting the body at all. We could be doing this with head down on our neck support, ribs pressed flat. You could also be bringing one foot back down onto the floor and just practicing a good, strong, neutral hold with one leg in tabletop. And then you just swap it over. Now, if you're doing a single leg, which you can do, especially if you're doing it daily, you might not want to do double tabletop every time. See how you get on. Challenge the expansion of the ribs through breath, strong arms, we're working our circulation every time we practice this as well. If our shoulders, if our head's off the mat, shoulder blades off the mat, right to the bottom. One more breath in and out. And then bring your knees into your chest, release your head down, place one hand on each knee, gently circle your legs around in your hips, and maybe even roll the shoulders a little bit there, just to bring some mobility into our hip joints, into our shoulder joints. Reverse them leg circles, take them the other way, and then glue your legs together and give your lower back a little roll around on the mat one way, and then reverse that and take it the other way. Okay, and then from there, we're going to curl the head and shoulders up. We're going to sit up into a seated position. You're going to try and find a comfortable seated position for you to do some rotation of your rib cage, so a little bit of mobility through rotation with the back. So you might want to do it cross-legged. You might want to have your legs out in front of you. See which feels best for you, but you want to be getting really up and level with your pelvis, level with your rib cage, balance on them sit bones, shoulders down, hands across the chest. Take a breath in. Breathe out, rotate your ribs to your right side without feeling like we're pulling down into the lower back. You want to feel the stretch across the thoracic spine, so across the back of the rib cage. Breath in center. Try and keep your head aligned with your shoulders, so chin sits centered with the chest. Breathe out to come to the other side. Breath in. Breath out. And maybe feeling some stretch across that middle back area. We're naturally working our oblique muscles as part of our rotation. We're bracing, we're lifting tall as we do rotation. Really look for good length through the spine. And try not to pull on your shoulders or feel the tension creep into them. Just focus on trying to turn from the ribs here as we keep the pelvis really still, which we can do in a seated position. You can always sit on a chair if you do struggle with the hips for this one. And then one more time to left side. You can come back to the middle, release that, come over onto all fours, where we're going to stretch the back out with some flexion again. So pull up through your tummy, tuck your tailbone around your spine and tuck your chin under. Rock back a little bit in that and try and curl under with your tailbone a bit more for an extra bit of stretch in your lower back. Rock forward towards the wrist. Rock back, tuck the tailbone under, extra bit of tightening of the tummy, rock forward. And then rock all the way back as far as you can towards the heels. Reach your arms out in front of you, splay your fingers out, press your palms into the mat. Take a couple of deep breaths there first of all. And then come out of there and up onto the knees. And then one leg out in front. Just going to give our hips a stretch as well. Back leg aligned. Stacking on the knee initially till you're tucking and squeezing your bottom. Flat back, push forward. Keep just practicing pushing forward to try and build the tension in the bottom, not dropping into the lower back till you feel a stretch right at the top of the leg into the hip. And then swap for the other side, just reversing that the other way. So other leg forward, stack on the knee with the hip, into pelvic tilt first. Really try and tuck and squeeze the bum. And then maybe from there you'll need to be driving that forward just to open and stretch into the top of the leg there, into the hip, and look to really feel the tension in the bottom as you're doing it. Okay, good. And then you can bring your knee down, bring your hands down, tuck your shoulders down the back, toes under, lift the knees, push back. Little heel steps to help us stretch the back of the legs out, alternating between the two so we can encourage a little bit more mobility there in one leg and then the other, just encouraging the length in the spine as well by pushing our ribs backwards every time we push a heel down to lengthen the spine more. Then push both heels back for a little extra stretch there. And then we can either walk our feet in towards our hands a little bit and then walk our hands the rest of the way towards our feet. Take your time, pull up through your tummy, extra bend of the knees if we need it to support the lower back, to bring us up and back into a standing upright position, and just give your shoulders a little roll out there to finish. And you are done. Well done.